What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video will cover basic X-ray classes you'll take in the program. So to give you context, I've graduated during 2021. Yeah, 2021. So I've been an X-ray tech for a few years. I do night shift. I 7 on, 7 off. I work a lot of overtime, so essentially I am like a PRN day shift. But anyways, those are my credentials as far as X-ray tech program, how it's programmed. From what I've seen, there's two different approaches that most school takes. There's you'll go to class and you'll learn everything, and then it'll be like class/clinicals, and then there's the class and clinicals. As you learn, you'll like go and check off stuff. So there's that aspect of it, and then there's one where you'll like do all the classes and then go all clinicals. So it's like kind of three approaches from what I've seen. Usually the first two approaches are the most common, and then the third one, where it's like old school and then all clinicals, it's not as common, but it does exist. We had a few people, but those are like from different like schools from bigger cities. But those are just some options that will happen through the program. But as far as like classes, if you want to talk about like just X-ray, we're not talking about like prereqs or nothing. We're just like just X-ray. You'll have like basic positioning, which is the anatomy of X-ray, which that's like your bread and butter. So if you're struggling to learn that, you're kind of as far as your job goes, because it's basically how to do your job. And then you have like basic patient care. You have physics of radiology. You have the advanced positioning, and then you'll have like your clinicals. You'll take several of those until you get your set amount of clinical hours that you need. And then you have the biology, and then you have like, there's like a little bit of a history, which the history is kind of like mixed in between several of the classes. It kind of sprinkles in a few knowledges of Rankin, the godfather of radiology, in the November, which is coming up. So there's those courses, and then depending on your school, certain schools like they'll cover all the basic like meat and potatoes that the board it wants you to know. But depending from what I've seen, certain schools will like focus on certain aspects more than others, because when you go take your exam, there's certain stuff that like your school may cover in depth versus not as much, because like there's so much information that is given, and like they literally, the X-ray board will literally be anything you have ever set your eyes on. The books is like fair game to be on the board, which is kind of intimidating, but you have to be well versed knowledge and everything. We have that aspect of it, and then we have pharmacology a little bit. Pharmacology is more of like, there's like a subsection of one of your classes. It'll be just like a chapter, because we really don't deal with too much, because like we just have like a few medications, a few stuff we deal as an X-ray tech. So that's something to look forward to. And then you have like your labs and stuff like that, where you like learn about the safety of radiation, and then like the transportation of like patients and how to like prep them and do all the lab stuff like that. You have that aspect of it. Certain classes have where you kind of do like research and stuff, but those are depending on your school and what their basic school curriculum involves. You may have like essays, and you'll have like projects they'll get involved into it. But those are like one of the most like common core classes you can expect during the X-ray tech program, which once again, depending on where you're going, you can probably do a quick Google search on the college, and you probably like can find like the basic courses that they offer, and you can just do a quick Google search. There's like probably several videos on it. I've made several videos a while back that cover each different courses that I took during the program and what to expect. I'm just giving you basic gestures of what is involved. And yeah, it's been your boy Miguel. See you on the next one.